This week, while the mainstream media obsessed about whether people wore masks at the Abraham Accord ceremony at the White House, these same media pundits and publications ignored 6 important news stories about COVID-19. Since they refused to report to you the data, the facts, the studies, the statistics, and the truth about COVID-19, we will. Number 1, according to newly released CDC data, which shows numbers through August 29th, predicted excess deaths in our country have moved below the threshold for excess deaths. This is really important because excess deaths is the best way to determine whether COVID-19 is killing people who wouldn't already die or whether people who are dying from COVID would be dying anyway. Hence the words excess deaths, which means more deaths than otherwise expected. According to Stanford biophysics professor Michael Levitt, who won the Nobel Prize for Chemistry in 2013, and I quote, CDC excess deaths to the 29th of August are 14% below baseline as predicted in July. This is the first time, he says, since March that delay-corrected death data fell below baseline. Excess death in the March to August 20th COVID-19 season may be over. A huge milestone, he says, end quote. Number 2, this isn't just true in the United States either. In the UK, flu and pneumonia deaths have surpassed COVID-19 deaths for months now. According to the Office for National Statistics in the UK, flu and pneumonia have contributed to more weekly deaths than COVID since June. As reported by The Telegraph, and I quote, just 78 people died of coronavirus in the week ending September 4th. The first time the figure has fallen below 100 since lockdown began in March. Just 1% of deaths now mention coronavirus on the death certificate, compared to 12.8%, which mention influenza and pneumonia, making those conditions nearly 13 times more deadly, end quote. In regards to excess deaths in the UK, the overall number of deaths have dropped below the 5-year average for England and Wales too, by nearly 1,500 fewer deaths the past few weeks compared to past years. Number 3, new data on face masks from Israel shows surprising results, indicating that masks may not be as effective as public health officials claim. Here's why. On June 24th, Israel increased the fine and increased enforcement of their face mask mandate. Since June 24th, COVID-19 cases have risen by 7-fold. Now, testing has also doubled in Israel since June 24th, so adjusted for testing, the rise in cases is probably 3.5-fold. But here's the thing. Deaths from COVID have been rising in Israel too. So it's not just a matter of more testing identifying asymptomatic or mild cases. In fact, if you want to get technical, according to Twitter science researcher Elgato Malo, Israel is seeing 2 deaths per million population per day. So how do you tell if masks are effective in slowing the spread of the virus? You test it against a control group. Gato Malo compares Israel to Lebanon, where masks are not required and people aren't really social distancing. Lebanon is also seeing 2 deaths per day per million population, which is the same rate as Israel. It's hard to argue that masks are helping when the mask group and the non-mask control group are seeing the same outcome. Number 4, what might work better to decrease the fatality of COVID-19 then? According to SciTech Daily, a new drug called AB8 has been found to be, quote, highly effective in preventing and treating COVID-19 in mice and in hamsters. Another drug, dexamethasone, a corticosteroid, has been found to be hugely beneficial in lowering the fatality rate for critically ill patients. For patients on ventilators, the drug reduced mortality by 1/3. Number 5, but our public health officials are so obsessed with COVID-19, other people who shouldn't be dying are dying. According to Professor Carol Sikora, the founding dean and professor of medicine at University of Buckingham Medical School, he's also the ex-director of the World Health Organization Cancer Program, the disruption to routine medical services caused by the government-mandated COVID lockdowns will cost countless lives. Sikora says, and I quote, "I'm often told to stick to cancer, so let me do that. Disruption caused to diagnosis, treatment, and research will cost countless lives. Coronavirus tunnel vision has caused the biggest cancer crisis in my lifetime. It's a disaster. I will continue to raise awareness of that," he says, end quote. Number 6, And yet, Dr. Anthony Fauci wants movie theaters, a staple of regular life here in the United States, to stay closed until a vaccine has been around for over a year. Actress Jennifer Garner asked Fauci during an Instagram Live, "When are we going to be able to sit in a theater and watch our favorite performers up on stage again?" Fauci replied, "I think it's going to be a combination of a vaccine that has been around for almost a year and good public health measures." End quote. Since the mainstream media won't report these updates, these reports, studies, and facts about COVID-19, we will.